PRP to restore hair color? Hi, I'm a 26-year-old male and was wondering if PRP can also help restore hair color in addition to hair growth. My hair is naturally black, but starting to have white strands in different parts of my head, not consistent. Also, slight thinning of my hair, which I noticed. My hair is not growing fast as it used to be.
Thank you for your question. You're 26 years old and you're asking if platelet-rich plasma can help with some of the various gray hairs that you're noticing in your scalp, as well as the concern you also mentioned towards the end of your question about certain areas of hair which might be thinning because it's not growing as fast as as your hair had done previously. So these are very good questions about what platelet-rich plasma can do, and I can certainly assist you with this. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic surgeon. I've been practicing in Manhattan and Long Island for over 20 years. Hair loss, hair transplant, and the management of hair thinning is a very significant part of my practice. In fact, I'm the founder of Tricostem Hair Regeneration Centers, where we use platelet-rich plasma with extracellular matrix in a unique system that we've developed over many years to help people with thinning hair. So to give you some additional information about platelet-rich plasma, first let's get just an understanding of what it exactly is. Platelet-rich plasma, which was originally described by oral surgeons, was intended to help the area where they were placing dental implants to become more vascular. So they were using a concentration by spinning the blood of platelet-rich plasma to stimulate the body's ability to generate blood supply by generating new blood vessels and to make the tissue healthier. And so when you think about it with platelet-rich plasma, when you take it out of the blood, you can place it in many different areas to help stimulate a healing process. So orthopedic surgeons have been using it, and physical medicine rehab doctors have been using it for tendon problems, for cartilage, for inflammation. There's a lot of different applications. And in fact, many professional athletes have actually gone outside of the United States to have platelet-rich plasma treatments. Now that being said, when it comes to hair thinning and graying, what we're talking about is still a genetic program. And when we first started using platelet-rich plasma and extracellular matrix, we were doing it for the purpose of hair transplant success. In other words, we wanted the grafts to heal better, we wanted the donor area to heal better. And serendipitously, the thinning hairs actually became thicker. Now, that being said, when I started developing a system of using this combination of platelet-rich plasma with extracellular matrix to treat hair thinning in men and women in a more consistent way and predictable way, we did notice that a lot of people who had salt and pepper hair, or even a lot of gray hair, a lot of their hair grew back darker. So, of course, we were excited about the possibility of using this treatment as a way to also treat graying hair. Unfortunately, it's a nice side effect, but it's not always a predictable side effect. Now, it has been my observation that if someone has had slow progressive graying of their hair with their hair thinning, and that their hair was darker relatively recently within the past few years, they seem to get more odds of getting the hair coming in darker. I've had patients who've been gray for many years and whose hair came in darker. At the same time, I've had patients who were gray for many more years and their hair came back just gray but still thicker. So hair regeneration certainly has value in helping people improve the gray hair, but it's not what we use as an indication. I found that essentially if someone has thinning hair, if the hair comes back darker, well, that's just a great bonus for now. Unless we really start pursuing this, I think that you can consider treating your thinning areas or beyond, depending on an examination, with hair regeneration, and then maybe as a beneficial side effect. Understanding that when we do a hair regeneration treatment, we're doing a single injection over this entire scalp, multiple areas, but one session. And with our over 5 years of data, more than 99% of men appear to be respond to this treatment, as well as 99% of women. And in fact, we can actually see a lot of people not need further treatment for 3 to 5 years. Now, in our practice currently, we do employ a secondary injection or injection done into the second year on some select patients, not as a way to keep the treatment going, but actually to augment the benefits of the treatment. So with that being understood, you can at least put things in perspective and understand there's a differentiation between PRP or platelet-rich plasma alone versus PRP in the way we use it with hair regeneration. So this is an opportunity here for you to learn more about this option. I would not say PRP alone would be of value as a treatment for graying hair. So I hope that was helpful. I wish you the best of luck, and thank you for your question.